What are eating disorders? Eating disorders are a prevalent health condition that affect many of the patients and communities nurses serve. It is imperative that we are aware of the impact they can have on health and how we can help. Eating disorders are defined as any range of psychological disorders characterized by abnormal or disturbed eating habits. There are many types of eating disorders that we will focus on in this video.
Anorexia is characterized by weight loss or lack of developmental weight gain, difficulty maintaining a healthy body weight, distorted body image, and restriction of calories or types of food eaten.
There are many health consequences of anorexia. Here are a few. The body is forced to slow down all of its processes to conserve energy. People with anorexia are also at risk for electrolyte imbalance and cardiac arrest.
Bulimia is characterized by a cycle of binge eating and compensatory behavior, such as self-induced vomiting, also known as purging.
Some health consequences of bulimia include electrolyte and chemical imbalances that can affect the heart, other major organs, and the entire digestive system. Those who purge may also experience tooth decay due to the strong acidity and vomit.
Binge eating is characterized by recurrent episodes of eating large quantities of food, a loss of control during the binge, while also experiencing shame, distress, or guilt afterwards. This disorder is not followed by compensatory measures.
Some health concerns related to binge eating include clinical obesity, weight stigma, and weight cycling. A person is more at risk for developing an eating disorder if they have a close relative who has also experienced an eating disorder, a mental health condition, or if there is a presence of familial trauma.
Eating disorders impact a wide variety of individuals. Those most at risk include athletes, people with disabilities, the Orthodox Jewish communities, the LGBTQ community, and adolescent females. However, eating disorders don't discriminate, and they can impact people of all ages, genders, and socioeconomic statuses.
Eating disorders, like many other psychological disorders, can often be misunderstood and not seen as a valid diagnosis. Some factors, such as a low socioeconomic status, less education, and low health literacy, may contribute to the misunderstanding behind these disorders.
Helping combat this public health issue starts at the primary prevention level. There are many examples of primary prevention out there. One noteworthy example that has been backed by decades of research and evaluation is called the Body Project. This campaign focuses on normalizing the conversation surrounding eating disorders. The conceptual basis for the Body Project is that the more we discuss the unrealistic body ideals portrayed in the media, the more likely our ideals will change. This in turn will hopefully reduce the prevalence of eating disorders.
One method of tertiary prevention for binge eating, bulimia, and anorexia that is supported by evidence is called dialectical behavioral therapy. This treatment focuses on developing mindfulness skills to replace eating disorder behaviors. It also emphasizes developing more effective relationships, improving emotion regulation, and distress tolerance.
So how can we help? Public health nurses have the power to educate, inform, and change the culture surrounding eating disorders. One thing public health nurses can do is become more involved with schools, as there are many school-aged individuals who have an eating disorder. They encourage schools to include units on eating disorders in their health classes and make resources available to students. Another way public health nurses, and all nurses for that matter, can make a difference in their communities is by recognizing when their patients are showing signs and symptoms of an eating disorder. Nurses have the ability to start those difficult conversations with individuals.